if their skull is a different shape, if they can't move their head and their neck is really tender, if there's a loss of consciousness, if they're seeing two of you in any direction, we're getting them to the hospital. Hi there, I'm Dr. Mark. I'm a concussion specialist who's been working with folks almost exclusively concussion for the past 5 years. I've worked with professional athletes, collegiate athletes, amateur athletes, grandparents, high schoolers, everyone in between. Concussion happens to everyone. And so on this channel, we talk about concussion recovery, concussion rehab, and how to get over symptoms so that you can get back to work, school, sport, or just your regular life. And today I want to talk about 10 warning signs of concussion, the 10 red flags of concussion. So a concussion is a type of traumatic brain injury. It's interchangeably called a mild traumatic brain injury. And traumatic brain injuries can be life-threatening if you miss the warning signs. 90% of the time, again, you look at the data, 80 to 90% of traumatic brain injuries are concussion and they're not life-threatening, but sometimes they are. And so I'm going to walk you through the 10 critical warning signs that you should never ignore in concussion cases. So whether you're an athlete, a parent, a coach, recognizing these signs or these symptoms early can make all of the difference. First, let's define a red flag. So you hear about red flags in medicine in general, and red flags are usually like, red flag, like, hey, alert, 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 something's going on here. So red flags are signs after a concussion. They're signs that could indicate a more serious injury or something different from concussion, like brain swelling, a spinal cord injury, intracranial, so like brain bleeding. And so we don't want to miss these quick actions here, like quick calling 911, quick getting to the emergency room. That can prevent long-term damage or even save a life. So this is really important to know. If you're interested, this red flag list that we're about to go through, you can find it on the SCAT 6, the Sports Concussion Assessment Tool 6, or the CRT 6, which is the non-medical professional version of how to identify a concussion. So it's the Concussion Recognition Tool 6. And when you look at the red flags list, you'll see neck pain or tenderness, seizures, fits or convulsions, loss of consciousness, double vision, increased confusion or deteriorating consciousness, weakness, numbness or tingling in multiple limbs, repeated vomiting, severe or increasing headache, increasingly restless, agitated or combative, or a visible deformity on the skull. When you get the CRT6, or if you're a medical professional, athletic trainer, someone on the sideline looking through the SCAT6, if you see any of these signs or symptoms, if their skull is a different shape, if they can't move their head and their neck is really tender, if there's a loss of consciousness, if they're seeing two of you in any direction, we're getting them to the hospital. So some of the real world implications I already kind of outlined, but we might see spinal injuries, we might see brain swelling or significant injury of the brain beyond concussion, we might see intracranial bleeding or pressure, and we might even see skull fracture. And so some of the signs and symptoms, if we've got a spinal injury, we might have neck pain or we might have numbness or tingling in the limbs. Something happened to the cervical vertebrae that's causing us to compress or pinch or have done something to a nerve that's making our fingers feel tingly, that's making us feel weak, and that's making our neck hurt. If we have brain swelling or significant injury there, we might be having seizures, we might be confused, agitated, maybe acting and looking a little bit drunk, slurring our speech, kind of stumbling. If there's intracranial bleeding or pressure, it might be a severe headache, it might be recurrent vomiting, there might be double vision, there might be loss of consciousness. And if it's a skull fracture, you might actually get a visible deformity of the skull. You might have bruising under the eyes or the backs of the ears. These aren't just symptoms, these are signs that something potentially life-threatening or permanently damaging is going on. It needs immediate medical attention. So again, resources for red flags, things just to have on hand and available to you if you're a parent, a coach, an athlete dealing with contact sports, if you're a football coach or the parent of a hockey player or a rugby player, a lacrosse player, even soccer, you want to kind of have this list ready. We know that 10 to 30% of all sports injuries are concussions. So that's 1 to 3 of every 10 injuries. Just having this ready. So one of the tools I already mentioned for non-medical professionals would be the CRT6, Concussion Recognition Tool 6. So it's a free PDF you can download, have on your phone, and it's got the list. It's like, did I see this in the injury? Are any of these symptoms present? If yes, great, sit them out. And another really, really great rule is when in doubt, sit out. You definitely want to remove from play, and you definitely want to screen for any life-threatening red flags. The other tool that I'm a super big fan of is called the Concussion Tracker app. So it's a free app that you can download on your phone. Your athletes, if you're a coach, all your athletes can create profiles and you can have them on a team. If you're an individual athlete and you're not really a part of a concussion team in the app, you can just have your own profile, but you can do a post-injury test and a post-injury assessment where the app actually asks you, do you have any of these red flags? And it walks you through that process. And if you do, it connects you with a concussion clinic. So if you need to go 911 or if you need to go just get a concussion eval to confirm or rule out the diagnosis. But what's really cool about that app is not only do you have the CRT6 screening tool capabilities in there, you can also do your own neurocognitive testing, you can also do your own balance testing, and you can connect with a concussion specialist in your area, the nearest one near you at least. To summarize, red flags are serious. Act quickly. You could save lives, you could save careers. So if you found this helpful or you think it could help someone else, go ahead and share this. Go ahead and like, subscribe, do all the YouTube things. Thank you for watching. I'm Dr. Mark, and I'll see you in the next video.